जैसे आपने rightfully कहा, I think everybody waits for better prices and bad markets, and good markets and good prices.
Hello and welcome to Business Today Television. I'm Siddharth Zarabi and you're watching Easynomics. On the show today, we continue to debate the National Medical Commission guidelines on asking doctors to prescribe only generics. You would recall that we had debated one side or a set of questions on this issue, and today we have another set of views on this, and for that I am joined by Sachin Taparia, the founder and chairman of Local Circles. I am also joined by Dr. Rajiv Jayadevan, the ex-president of the IMA, Cochin. Welcome, gentlemen. The National Medical Commission August 2nd directives are before us, and before we sort of get into some of the issues, Sachin, you have done a survey and got several responses. In fact, one of the points here, which is roughly 12,400 responses, viewers, then the survey points out that 85% citizens that were surveyed by Local Circles support the NMC guidelines that restrict doctors and their family members from receiving gifts, grants, commissions and any other gratification from pharma and medical device companies. Sachin, explain this finding to us and take us through the fine print.
So, Siddharth, we have been on this subject of, medical ethics and doctor ethics for over 7 years now. Local Circles has been the primary platform where people have come out over the years and shared their experiences of, what they see, what they observe, in terms of, doctor, chemist nexus, doctor, pharma company nexuses, the doctor connect with the pathology and diagnostic labs, and people have reported instances. So when we did a national survey to understand the perception of the people about their own doctor, 3 in 4 citizens basically in the survey said that they believe that their, doctor is receiving referral fee or, commission or what we call as cuts from these different entities in the supply chain of healthcare. And subsequently, when we asked after, the guidelines came about, that, whether these guidelines that restrict doctors and their family members from accepting such gratification, putting a restriction on accepting such gratification, do they approve of such guidelines? And that's where we received, a wide majority of 85% basically saying, yes, this is something that we've been looking for. At the same time, a lot of people are skeptical whether they will be enforceable, whether they will be implementable, and who and how will do the implementation, and where will they go if they observe, another instance of this in terms of filing a complaint. So yes, good, very high approval rate, but at the same time, a bit of skepticism that this shouldn't become like another, tobacco law where you have a law, but it is not being enforced because it's very, very hard to enforce. So that's kind of in a on medical ethics.
Absolutely, and you make a good point there that there are certain laws which may be well intentioned, but when it comes to implementation, run into various practical issues on the ground. Dr. Jayadevan, I'm coming to you, and not just as a ex-president of the IMA, but as a practicing doctor yourself. Before we get into some of the broader issues around generics and prescriptions. Does this central finding of this survey, and let me remind our viewers once again, 12,400 odd responses, 85% conclude that that NMC guidelines, that doctors are actually receiving this kind of gratification. Is this correct? Is this actually true on the ground as per your experience?
I've practiced for over a dozen years in Western nations and longer than that in India. I have not encountered a single instance where this is true. Now, that does not mean that it doesn't exist. Corruption of all forms exists in every field, in all countries, in one way or the other. And medical profession is no exception. In fact, in the Indian Medical Association's ethics classes, ethics seminars, these are very commonly discussed topics that there is a line between what is called a promotion of, let's say, a detailing of a pharmacological product, and what that is not the same as accepting financial or other incentive from any company. So there's no doubt about that. All doctors are agreed, and all professional associations are agreed that bribe in any form is not acceptable, whether it's in the healthcare profession or otherwise. But as you know, as Sachin also said, irregularities do occur. There are bad apples everywhere in every profession, and medical profession is no exception. But from my experience, I've not been faced with a single person who asked me to sell their product in return for a financial favor. Never, ever. It's perhaps the kind of reputation I have built up might have stopped them from doing that. I do not know, but I can tell you from over 11 years of direct, continuous practice in our country that this has not happened. And the same thing with what we call CMEs or scientific seminars. Many people, especially in the lay public, believe that these scientific seminars are promotion. They're not. These are high quality scientific seminars that do not discuss the products of the company that might be sponsoring it. The company might be helping with the hosting process, the logistics, but they don't come out and say, look, if you prescribe our product, you can get entry into the site. That is not true. So there's a lot of public perception. Surveys essentially are a marker of public perception. And I applaud Sachin for doing these surveys. Sachin has done wonderful work, not only in this area, but also in the field of code, where we had both work together. So public perception is important, and that is an important aspect, especially when we are talking about regulations coming in, newer regulations coming in. Measuring public perception is an important part of that. And coming back to your question, does this occur? Yes, I'm sure it occurs, because if it did not occur, the public would not perceive it like this. But are all doctors like that? No, definitely not. None of the doctors in my circle, as I mentioned, have engaged in this behavior. It is quite possible that there are people doing that, and must be strongly discouraged. And also the laws must be enforced, because unless laws are enforced, such behavior will not stop.
That's an important point about enforcement of laws. And the second graphic that briefly came up on your screen, viewers, and we'll get that back up on the screen, and this is to do with the question that local survey circles asked: who all do you believe are providing incentives, commissions in cash or kind to doctors and specialists? And the answers, and you can see the color coded numbers there: pathology, diagnostic labs, private nursing homes, hospitals, chemists, pharma companies, most or all of them, most of the above and a few others, and none of them can't say. And Sachin, take us through this particular finding. How do we read this pie chart?
So, really, Siddharth here, what the pie chart indicates, that this is a prevalent practice. At least that's what the pathology and diagnostic labs. And I think if one goes to especially some of the smaller towns, in the past years, stings have been done by different channels, even in Delhi, the South Delhi area, But if you go to any of the small towns and you basically visit, a doctor, you'll find that there is pharma company reps that are sitting there spending time. If you talk to the labs and really get down to understanding how their business model functions, it is extremely common to provide a referral fee or a commission to the referring doctor, essentially. So and same thing with hospitals and nursing homes. So it's a prevalent practice. It is something, like Dr. Rajiv said, it must be thoroughly discouraged and enforced. And I think that is why the public is saying that, yes, this is a prevailing practice. Number one, we approve of the guidelines, what it says, but the reality or the success of any reform like this will only be visible when you enforce this on the ground. And, of course, in any system, there are, good or highly ethical practitioners like you have, with Dr. Jayadevan. And I'm glad, he spoke about this.
Okay, we seem to have a bad line with Sachin, and we'll try and reconnect with him. I'm coming to you again, Dr. Jayadevan, and on this issue of what Sachin spoke about, the general view, the impression that a lot of the public has, because medical representatives are constantly in touch with doctors, you have them hanging around medical facilities, around doctors' rooms. Sometimes during consultations, there might be a medical representative also waiting for. So does this generate this kind of impression, and isn't there a better way to deal with industry stroke doctors' exchange of views? I'm sure there must be good valid information to exchange and it's not nefarious all the time, but isn't there an alternative?
It is a very, very good thing that you mentioned the specific example of medical representatives sitting outside a doctor's office. You know what? That is the difference between bad perception and good reality. Perception can drive you to wrong conclusions. You know what? Medical representatives are perfectly eligible to approach practitioners and brief them and detail them about medical products. It is perfectly 100% legitimate. That is not to be equated with bribery, or which is why it is these observations that go around in whispers by people who do not understand what happens is that leads to wrong perception. So let me get that very clear. Medical representatives are expected and are perfectly entitled to see doctors and brief them about their products, discuss the various levels, the effects, the comparison studies, and so on about their products, the drawbacks of their products, comparison with previous versions, and so on. So please do not misunderstand an honorable interaction as something that even remotely suggests bribery. It is not. They may leave a product reminder like a paperweight or a pen with a brand reminder. That is perfectly legitimate. That is not called a bribe. A bribe is hypothetically if this person brings a bag of cash in exchange for favors of his product. Now that is a bribe. So I just gave you a hypothetical. That is not what the representative is there for. So I just wanted to get that out of the way very clearly.
Okay. Now let's bring up another key finding, and this is the graphic where roughly 20,706 responses on the question have responded to say that only 7% citizens surveyed approve of their doctor just providing the name of the salt when prescribing medicines. 60% are in favor of doctors writing both the brand name as well as the salt. And the questions that were asked, and that's on the screen, viewers, you can also read through it, but it's basically, as a patient, what would you want your doctor to prescribe for your ailment. And this is the crux of today's debate and the debate that we've been having earlier. And the responses are varied. You can see 60% of the responses saying a branded drug along with the name of the salt in case the patient wants to opt for generics, followed by name of the salt and as an example the name of a branded drug. Sachin, if you are back with us, I want you to explain this particular set of responses for our viewers.
Absolutely. So this has been another, major subject of discussion since the NMC guidelines came, Siddharth. And this is where, when we asked people, what is it that they want to see on the prescription, a whopping 60% people basically said that, look, I want to benefit from the doctor's experience and their knowledge with different medicines and their diagnosis, of course. And therefore, I want the doctor to write the name of the branded medicine that they recommend, as well as the name of the salt. So that way, if it is something that I cannot find, I have an alternate that I can, get in my area or from my chemist. Also, if I cannot afford, the branded medicine, because let's say it's expensive and beyond my budget, then I can go and seek an alternate medicine. But by default, I want the doctor to give me the branded medicine and then give me the salt as well. So I have the flexibility. 22%, respondents basically in this particular poll also said that they want the doctor to prescribe the salt and give the branded medicine as an example. So all in all, 82% want both, the branded medicine as well as the name of the salt. So they have the flexibility of buying a
Sachin,
generic.
therefore, the question that comes as a consequence of this is now the central part of the question that we've been asking over different shows, which is the NMC directive, guideline, regulation excessive? Because when I read it, it suggests that except in certain cases, exceptional cases due to the kind of ailment or the lack of a wide spectrum of drugs, the doctor is to only prescribe a generic. So does it mean to say that in the sample size that you have, well over 80% want choice, while as the NMC directive is far too narrow in comparison to this finding?
Absolutely. So if you look at the other two data points, so that's only 7% respondents basically have said that they only want the name of the generic salt in the prescription, and only 7% have said that they want only the branded medicine in the prescription. So very clearly, people don't want the doctor to make the choice. They want the doctor to recommend. They don't want the chemist to make that choice for them, because the chemist could make the choice. They could prescribe a generic where they have, let's say, the highest commission rate, for instance, right? So therefore, they want to make their own informed decision. They want to benefit from the information and the experience of the doctor. They want to also know the salt, right? And then, make a call whether it is the branded medicine. If let's say it's a paracetamol and brand A and brand B, the cost really isn't, very different. They want to go for the branded medicine that the doctor is suggesting. But if the price of the drug is excessive or the branded one is not available, then in that case, they want to go to the chemist and say, okay, what are the alternates, and tell them what they want. So I think that is where there is a big disconnect with what the NMC guidelines currently are suggesting and what the people actually want. And, very clearly people want the flexibility and the decision to be their decision rather than it being of the doctor or the chemist.
Okay, people want this to be their own decision. Dr. Jayadevan, what do these numbers tell you? People want to exercise their choice, free will really. They want to know the best, and they also want to know the base drug, the salt that is composed of in what the doctor is recommending.
Okay, our viewers might not necessarily fully understand the word generic and branded. It's quite possible without a healthcare background, you might have a vague idea, but actually they may not understand. So that might have influenced the survey. But let me give you, to make this absolutely clear, let me present a very simple hypothetical example. Let's say we go to a shop. I go to a shop to buy toothpaste, and I use Colgate. It's just my choice. Or let's say I use Closer, common brand. I go to the shopkeeper and say, I want Colgate toothpaste. The shopkeeper says, no, you can't have it. Then he gives you a blank white tube of toothpaste and says, you can have this. And I go, excuse me, I wanted Colgate, not a white tube of paste. He said, no. According to the new law, I decide what toothpaste you will take, not you. And this is the predicament that the doctors are facing now. Doctors, through years of training and many years of experience of prescribing, treating patients, seeing patients who don't improve, seeing patients who improve, interacting with others, collective experience of other people being present in conferences of peers, doctors form their practice patterns. And you know what? The doctor-patient relationship is very special. It's not like the doctor-farmer relation, not like the patient-farmer relationship or the patient-pharmacy relationship. The patient goes to the doctor for relief of a problem. And the doctor, the prime priority for the doctor is for the patient to get better on all counts. A, it is medical ethics that the doctor practices. Two, if a person comes to you for your expertise is to make the problem go away. And so the doctor will do everything in his or her power to make the problem go away. And an important part of that is diagnosing properly. And second, picking the right medication in the right dose, in the right quality. Now, therein lies the problem. I've practiced in the US for over 10 years, and I have no problem with prescribing any generic name because all the generic medications available in the United States are quality controlled by the FDA with a limit of 0.1% impurity, less than 0.1%. So I know that every generic medicine available in that country is so carefully controlled, I don't have to worry about a brand. But in India, we are still getting there. We are a long way from reaching that target. In other words, if 100 companies make the same medication, it is 100 different qualities. The level of impurities, the storage conditions, the manufacturing conditions, the personnel who use it, the facility, all of these are different. And as Sachin mentioned, the markup is what most people have no idea about. You know what markup is? If a product is sold to a shop for 10 rupees and it is marked up to 17, the patient may think it's a cheap medicine, but the person makes a profit of 70%. Now, a reputed maker might not give a very high markup. So it's a complex issue which I think our audience might not clearly understand. And to put things in very simple language, I'll say this. If I take my mother to a doctor with pneumonia, I don't treat pneumonia. I'm a gastroenterologist. If I take my mother to a doctor with pneumonia, if he or she writes a prescription, I will want exactly that medicine, regardless of whether it's available in that shop or not. That's the way I practice. So I think that these two stories will help our audience understand the complexity of the issue. Generic in our country is not the same as generic in the most developed nations in the world. I think we should clearly understand that. A doctor should have the privilege to prescribe what he or she believes is the right medicine for the patient. You can't take that privilege away from a doctor. And you can't let somebody else decide that. For instance, the person at the counter of the drugstore might not even be a pharmacist. In fact, in most instances, it is just a clerk who's learned on the job. Now, what qualification does that person have to decide what brand or what medication this patient should be having based on the doctor's prescription?
Right. Sachin, in this, we have taken three questions today and the responses. Summarize it for us. It's very clear that the ideal set of sort of directives have been framed, and perhaps the underlying assumption has to do with both suspicions and fears about prescription malpractice, as well as a belief that too much profits are being made in the so-called branded drug segment, and therefore affordability must be pushed. And in fact, the guidelines actually refer to that. What's your own view as to the dilemma that your findings present for policymakers should they choose to respond to them?
So Siddharth, we are going to escalate them to all the findings of this survey on Monday. But basically, see, what the findings are suggesting is that we do have a medical ethics problem in our country. At least that's what there's a very strong perception amongst the citizenry that this is something that needs to be reformed. It exists, and the NMC guidelines are a forward-looking step to reform the medical malpractices that exist. So by and large, there is support for the NMC, bill or the law. At the same time, people are skeptical that, how will you enforce a complex law like this, where, health being a state subject, how will the complaint grievance redressal mechanism work? How will you get status of a complaint? Will you take collective action on some of these issues? If there is a medical chain or a brand involved and there is, a violation. So I think all of that has to be figured out from an implementation standpoint. Okay. Now, coming to the prescription bit of what people want to see in the prescription, the doctor's prescription, there's very clearly, the survey indicates that people are not supporting what the government is proposing. So I think that's something that the government ought to take note of and, go back to the drawing board basically and say, look, there is an issue here. Let us look at what the public feedback is. Let us, also evaluate the entire, the pharmacy or the chemist that in some of these cases been given to an individual, but that individual is not even sitting at the chemist shop. They're probably 200 kilometers away, right? Okay. And somebody else is operating the pharmacy. So therefore, if a customer goes to a pharmacy like this and they are able to, because the person who is sitting is not, knowledgeable, and they give them, the wrong medicine, it could be a public health issue too. So I think that is where the government has got to look at all the pros and cons and say, look, this is something that we will reconsider ideally and take the citizen feedback and then come back with a revised policy that makes sense and that is more acceptable to people.
Dr. Jayadevan, last 30 seconds on the show, and the question to you, given the feedback from the public, and this is a pretty sizable sample on this sensitive issue, what's the way forward? Is there a middle ground kind of that can be approached, or will these guidelines go the way of so many other guidelines which seek to control things, enforce certain kinds of behavior, but on the ground, reality doesn't change?
Similar discussions have occurred even before, and doctors stand and doctors association stand from the point of view of medical ethics is absolutely clear. Bribery of all kinds is wrong and must be discouraged and must be punished by the law of the land, regardless of what profession it is. Now, that is not the same as taking away the privilege of prescribing medications from a doctor. Now, the two are completely different. There's a dichotomy there. People must clearly understand the difference. Doctors prescribe medications in the best interest of the patient based on their experience. The doctor will never prescribe something that will make the patient's condition bad. Now, if the patient has a financial constraint, most doctors will have a means of many doctors, in fact, take money out of their pocket and pay them, or give them give them samples, or they can even contact the pharmacy and ask them to give a discount, or expensive medicine. Sometimes manufacturers themselves offer special packages for people who financially are finding it difficult to purchase medication. There are so many avenues that people can follow in case of financial difficulty. So it is not like the doctor is writing the most expensive medicine all the time. It is not. So the doctor-patient relationship must be understood very clearly. I don't think that's been addressed very clearly in this apparently well-intentioned update. So prescribing privilege must 100% remain with the doctors. There is no doubt among all doctors' minds about that.
Absolutely. That's a good point to end this discussion on, that 100% or entire privilege of writing a prescription, choosing specific drugs and prescribing them in a manner which the doctor is comfortable with and which ultimately does good for the patient, I think that is the most primary purpose of any regulation, and regulation needs to be enlightened. Sachin Taparia, thank you very much for sharing these survey details with us, because they not only add to the debate but have also informed us about what public opinion would be. And of course, I would say that a much larger sample also, if it were to be done, would perhaps show us similar results. So thank you for your time with us today, and Dr. Jayadevan, thank you for sharing your insights as well. Viewers, with that, it's a wrap on this episode where we have discussed the new guidelines which promise a branded drug-free Mukt prescription and a generic prescription only. Will it actually translate into reality on the ground? We'll have to wait for that. Until then, we'll be back once again with more. And before we go, I want to request all of you to send in your questions on any market related, stock related queries that you might have. Market Masters with Nilesh Shah will be live once again, as it is every Monday, and you have till 4 p.m. tomorrow to send in your questions on 7303080488, that number right on your screen. If you want to know how to pick the best stocks and create a winning portfolio, tune in to get all that knowledge. Send in your questions and we'll get you those answers. Until then, we'll see you again. Goodbye.